Procedure is finished. We then take the patient totally off of gas and has pure oxygen, and we start to remove all the leads, pulse ox, and blood pressure cuff that is attached to our monitor. We then take him out of the OR into a cage to recover. Setting up the operating room. When setting up the operating room, it is first important to know what procedure is being performed at that particular time. Here I'm setting up for a canine spay. I put a towel over the hot water blanket to make sure the patient does not get burned during the procedure. Next, I hook up our anesthesia machine into our scavenger and oxygen systems. It is also important to check your level of ISO. Next, I start getting our monitor set up. I pull out all the leads, lines, and like thermometer, blood pressure cuff, EKG lines, and pulse ox. I plug them into the monitor and run them across the anesthesia machine like the particular technician prefers during this procedure. It is important to know who will be running anesthesia because everyone seems to like things set up differently. You want to do it to how they prefer, so when they go bring the patient into the OR for the procedure, they can quickly and efficiently hook up the patient to the monitor. Every surgery of ours is recorded on our monitor and hooked up to the patient's and linked to the patient's chart. Once the monitor is set up, I then get out a scalpel blade and the correct suture material for the spay. We only have a few different packs, but for this particular pack we're using the spay pack. I then get the Mayo stand out and put the suture scalpel and pack on the Mayo stand on the right side of the table. The particular doctor during the surgery prefers it to be above the table height and to her right for this particular procedure. We also like to have fluids readily available for every surgery, even if it's not thought that it would be needed. I put the IV pole on the opposite side where The doctor will be standing on the technician's side or the anesthesiologist in this case. Next, you adjust the lights to where the animal might. Patient prep for surgical procedures. The surgical site is usually prepped after the animal is anesthetized. The hair is first clipped in the same direction as the hair growth, and then it is clipped against the direction of the growth to achieve the closest shave possible using a number 40 blade here in this video. A wide region of skin is clipped around the proposed incision site. A general rule is to shave 2 to 4 centimeters in every direction for the proposed incision depending on the size of the animal and location of the incision. For abdominal procedures, the clip should extend several centimeters cranial to the xiphoid, caudal to the pubis, and lateral to the nipples. Long hair growing near the propriety of the clipped area should be cut short enough and cannot overhang the clipped area. After clipping, a vacuum cleaner may be used to eliminate loose hairs on the skin. The surgical clip should be thorough but gentle. Unnecessary roughness will result in inflamed or traumatized skin, which can cause greater post-operative complications. Once the surgical site has been clipped, then you can begin your surgical scrub. In some cases, many people wear gloves. At our clinic, we do not. The surgical scrub is performed by alternating an antiseptic scrub, which in this case we are using Chlorhex, with sodium chloride. Scrubbing should begin over the proposed incision site and extend outward in a spiraling pattern, never going back towards the center with the same gauze sponge. The sponge is replaced with a clean one, and then the process is repeated until no dirt is visible on the discarded sponges. The sterile scrub is done once the animal is properly positioned on the operating table. This is the first out of 2 scrubs that we do before the surgical procedure is performed.